Hello, I'm Beth Smith-Hauskamp, Administrative Chief Operating Officer and Chief Nursing Officer. 2016 has been a year of change, innovation, and accomplishments for the Department of Nursing. We'd like to take the opportunity to communicate and celebrate our achievements from this past year and look forward to opportunities for growth in 2017 and beyond. This video is in response to survey results requesting different methods of communication regarding nursing. It will highlight the nursing survey conducted earlier this year, how your feedback was used to improve our practice, to provide the best care for our patients and their families in the communities we serve, and how we are embracing technology to shape our care and processes for years to come. Andrea Hauser will discuss our improvements to nursing practice, and Shannon Hewlett will be your guide on technology. We appreciate your attention to this message and welcome your continued feedback. You make the difference.
Hello, I'm Andrea Hauser, Director of Nursing. 2016 has been an exciting year of learning in my new role as Director of Nursing. I want to thank the nearly 600 inpatient, outpatient, and regional nurses for completing the nursing survey conducted in January. We had not taken a pulse of our nurses in many years. Your feedback has been extremely valuable and is guiding some exciting changes in our practice. We worked hard this year. One example demonstrating this great work is the recognition as the best workplace for men in nursing. This national recognition speaks to your commitment to creating a culture where all nurses can develop professionally. You should be proud. Celebrating our achievements, big and small, is important. That is why, on the nursing survey, we asked if you attended the Nurses Week celebration. 74% of you were unable to take part. You told us the dinner was difficult to attend due to work and family obligations in the evening. So in 2017, we will be offering a daytime open house on our La Crosse campus. There will be an option to enjoy breakfast or lunch, and we will also continue to recognize your exceptional contributions with the Nurse Excellence Awards. You can look forward to a combination of unit and system activities during Nurses Week to recognize all of your efforts. More to come on this. Several survey questions shed more light on our nursing professional framework, the structure that guides each of us to evolve in our profession as a whole. We asked, is the nursing professional framework valuable to your practice? And 71% of you told us the framework was either somewhat or definitely valuable to your practice. When asked to describe the framework, you provided excellent insight and helped us to understand that some confusion still exists. The Nursing Professional Framework was launched in 2013 to help define what it is to be a professional nurse at Gundersen Health System. To those of you who felt it is what you do every day, you are correct. The framework is meant to embody the professional nursing culture at Gundersen. To continue to add value to the framework, the Nursing Professional Framework team is working to clarify the components. Additionally, the framework will be used to organize resources on the nursing website. Also key to our practice is communication. On the survey, we asked, how would you like to stay connected or be informed? You provided a range of responses. Among your top preferences for receiving information were face-to-face communication, social media, and other, in which you indicated email, bridges, and corporate communications. Your feedback is helping us make important changes to better connect us all to each other, our practice, and to our community. Among those changes will be a new and improved nursing website. Our goal, transform the current nursing website on Gladiator into your go-to resource for all things nursing related. There, you will find schedules, calendars, videos, and communication in an easy-to-navigate format anchored by the Nursing Professional Framework. Using the framework to organize the content of the website will help each of us to engage with the framework, which should lead to better understanding and value. It will also help serve as a useful recruitment tool. I can't wait to see the end result late next year. To enhance communication at all levels of practice, we launched the first Nursing Touchstone group in November and are also making improvements to the nursing councils. The Nursing Touchstone group is made up of randomly selected nurses throughout our health system. It will mimic other Touchstone groups at Gundersen, which allow frontline staff to share the latest buzz in their departments. The information that's collected is shared with senior leaders. What a great opportunity to identify connections between nursing practice and other specialties. The nursing survey also asked if you felt our current nursing council met your needs. 61% of respondents said yes, definitely, or yes, somewhat. Katie Cook, an inpatient orthopedics RN, and Jill Blackburn from the Department of Nursing took a deep dive into your comments and have worked to further improve our shared governance structure. Improvements include leadership development for council leaders, templates for units and departments to display who their council representative and UPEC or DPEC members are, as well as linking council minutes into Nursing News Stat. These are short-term wins that we will implement immediately. We look forward to providing additional opportunities for nurses to make enhancements in practice. Finally, we look forward to communicating our work and accomplishments to the broader organization and community with a nursing annual report. You will be among the first to view it during the Nurses Week celebration in May. In order to increase opportunities for face-to-face communication, the Department of Nursing has restructured the assignments of the nurse educators to assure each department is represented by and has access to this resource. Additionally, Beth and I have rounded in the hospital, clinic, and regional sites and will continue to do this in 2017. It's been an honor to serve as your Director of Nursing. Many great things have been accomplished and many more are in store for 2017.
Hi, I'm Shannon Hewlett, Informatics Nurse for Gunderson Health System. With your help this year, we built and improved connections between inpatient and outpatient nursing practice and aligned this care with technology, ultimately for better patient care. One connection is my role, Informatics Nurse. With a background in nursing and an interest in technological support of clinical processes, I provide guidance and leadership to make technology work for you and for our patients. We've also moved other nurses into roles focusing on technology projects. We're working to coordinate care and improve workflows, engage you in the design, implementation, and evaluation of IT systems and products, increase the use of standardized clinical decision support for nursing, and integrate equipment like mobile devices into your workflows. Our goal: improve the health of patients, communities, and families while making work more efficient and satisfying for staff. We are doing this by optimizing information management and communication through collaborations with Gunderson Information Systems and a variety of clinical specialties. Nurses represent the largest group of healthcare professionals and the most frequent user of the electronic health record and many other health information technologies. For these reasons, we're creating structure and processes to support practice and technology intersections. In addition to help for nursing practice, this year's nursing survey helped drive changes to nursing technology and related processes. 2 survey questions related to technology stood out. The first and most relevant question was, what do you think could be changed to the EHR to help support your workflows and better tell patients' stories across the continuum of care? You provided great comments for improvements to the number of flowsheet rows, irrelevant flowsheet rows, redundancy in the EHR, and lack of information in certain areas of the EHR. Documentation should exist to support patient care, improve outcomes, and be as efficient as possible. Your feedback led to the transformation of inpatient pain assessment and reassessment documentation and patients' pain management status visibility in the EHR. Through the evaluations after the transformation, we found improved staff satisfaction and efficiency. We're currently working on the connection of pain documentation and documentation visibility between the outpatient and inpatient setting. The second relevant survey question was, with emerging technology impacting nursing practice and patients to such a great extent, what ideas do you have to help nurses apply and integrate the technology into their practice? You showed great interest in being involved in work related to technology and practice intersections. In short, you said, involve me sooner and teach me differently. Some of our current projects and projects for 2017 address this feedback. A preliminary EPIC site visit this year focused on current state assessment on the EHR and the nurse's needs, including nursing documentation. One objective of the assessment was to analyze the current state of practice and technology adoption, including opportunities for improvement. Inpatient nurses, clinical informaticists, nursing leaders, and EPIC staff all participated in the site visit. An important finding of the site visit: many flow sheets are not used or are rarely used. Specifically, of more than 3,000 inpatient flow sheet rows active in December 2015, 420 rows accounted for 80% of the documentation. While the initial focus was on the inpatient setting, we also addressed the link to outpatient and procedural areas. An important project for improving the telephone nursing processes and tools in the EHR is underway, along with a tool to display the plan of care for patients, which will be a tool for all clinicians in all settings. New this year was the formation of our Clinical Informatics Council. This council, which you may know by its internal name C4, launched in September. C4 facilitates better alignment of technology and practice intersections for nursing. The primary members are nurses from a variety of departments, including nurses from our 4 regional centers and key information systems staff. This council provides direction for and supports intersections for all clinical technology impacting nursing. The Council's first project relates to simplification of the admission process. More to come in 2017. C4 is inpatient focused, and we are in the beginning stages of creating a similar structure for outpatient nursing in 2017. The next year will bring work on some exciting projects, including secure messaging on mobile devices, new IV pumps which will integrate with the EHR, and as I mentioned earlier, the telephone nursing process to allow ambulatory nurses to manage symptom-based calls more safely and efficiently. Thank you for your partnership to improve the connection of technology and nursing practice.
What an amazing year! We've made great progress to improve care for our patients and leverage the important connections between nursing practice and technology. 2017 will bring more exciting changes to our work. As we prepare for another great year, your feedback is encouraged and valued. In the future, we will have more departmental surveys to get your thoughts and ideas and identify areas of opportunity. From La Crosse and Onalaska to Sparta and Tomah, from Decorah and Spring Grove to Hillsborough, Prairie du Chien, and everywhere in between. Thank you for elevating our care and supporting each other as we improve together.